Our next speakers, Mary Phelan is the Head of Costing at the Healthcare Pricing Office, and Geoghegan is the Business Intelligence Developer at the Integrated Information Services, HSE, big title, and they're going to talk us through this ABF activity dashboard so you can all see the meat of how this really works. Mary, you kick us off, please.
Thank you. So the ask with this was to develop a data visualization tool to make hyperactivity more visible. Hyperactivity more visible and meaningful to all the stakeholders out in the system. There's probably been a need and an ask for this for a number of years, but our work with the department and the NPU over the past year has crystallised that, and we've got to the point now where we've developed a dashboard. The key stakeholders involved in that have been ourselves and the HPO, the National Productivity Unit, who developed the first proof of concept. IIS then took that and redesigned it and have developed the tool that John is going to demonstrate for us today, and also thanks to the ABF staff in the regions who did some initial testing on it for us. So as I mentioned, it's become part of the Productivity and Saving Task Force action plan. It's one of the products for ABF improvement. It's been designed to help drive improvement in clinical and operational processes, to give the regions an opportunity to review and understand their ABF benchmarking performance through exploring their data. I suppose for years everybody has been able to see their own data, but there's no way of knowing if that's good or bad if you can't compare it to your peers. And also to give insights into the analysis. So it's not going to be all things to all people. It's a very large data set, so a number of key metrics have been chosen. These are the length of stay, the weekend discharges, the day of surgical admission, surgical day cases, and DRG complexity. And there's also some overview screens and demographical and geographical analysis that John will take us through. As always, any tool is dependent on the quality of what goes into it, so it's dependent on the coding coverage and the coding quality. It does contain patient-level data. The access control in this will have to be strictly managed. The hospitals themselves will be able to say who gets access to their patient-level data. Data sharing agreements will have to be put in place for the voluntary hospitals. And until they're in place, the data is pseudo-anonymised for them. Joe and the HPO, along with IIS, are developing an access control protocol. And the initial access was designed to go to the 6 deep dives, but I imagine when you see it, everybody's going to be clamouring for it. So I'll hand it over to John now, who'll show you the actual tool itself.
Great.
Thank you.
John.
Sorry, my screen is locked here.
This is a live demo, by the way, so a little bit of tension.
Drum roll.
So I used to work in software, and we always had the live demo, and then we had the backup fake live demo, just in case.
Thanks, Mary. So yes, my name is John Geoghegan. I work at the IIS. I'm just going to give you a quick overview of this new dashboard we've developed for the HPO. Just for those of you who aren't familiar with the IIS, we're the main data analytics service for the wider HSE, and we fall under the office of the CDAO, the Chief Data and Analytics Office. It's a new office that's just been created, and Tom Lavin was just recently appointed as the first CDAO. We provide a lot of services, mainly products around dashboards. We've recently created dashboards for the IFMS project and scheduled care. Going back, we did the UK response dashboard. Going further back, we did dashboards for COVID monitoring and test and trace. So this is one of our latest dashboards. As you can see, it's still in test, but we hope to publish this soon. So I'm going to just give you a quick overview of some of the pages. We can't go through all the functionality. That would take a little bit too long. This is the cover page or the landing page. So if you get access to the dashboard, this is what you'll see initially. And I'll just draw your attention to this email down here at the bottom. This is the iis.team@hse.ie. That's our email. So if this is for any feedback, and we're always looking for feedback, good or bad, so you can send feedback to us via that. The dashboard, the idea is that it'll be updated once a month. So it'll have the last complete months of data. We just have data up to 2018 to February of 2025 at the moment. We hope to have that up to date before we go to production. So, and also the data comes from Hype. So if you're not familiar with a Power BI dashboard, you can navigate using this menu here on the left. As you can see, we have 9 report pages, 10 including the cover. And you can hide that just to give yourself a bit more space. So let's have a look at the first page. So we have 2 overview pages. This is the national overview page, and then we have another consultant overview page. We put a lot of effort into the dashboards to make them clear and concise and uncluttered as possible. So you kind of read from top left across. Obviously, you have the title of the dashboard at the top. Top left, you have the name of the page. Coming across to the right, you'll see we have what we call the data context. This just tells you what data is actually on that particular page, because different pages will show different data. So this particular page is showing you the year to date for the most recent year up to the most complete month. Other pages will show different amounts of data. Then we have this about this page section, which just gives you kind of a brief summary of what the page is trying to tell you. Here we have this large section here, data, summary and statistics, which will give, so this page shows us national overview of 8 high-level metrics. So we have total cases, day cases, inpatient, etc. You'll have the year to date, same period last year, changed since last year, and so on. Then this section here, we have comparisons and trends. So when we were developing the dashboard with Mary and Fico, one of the things they emphasized a lot was this idea of peer-to-peer comparison. So we tried to build that into the dashboard as much as possible. So there's a number of ways that you can make comparisons. So the first method here is by hospital model. You can also do it by health region, and you can also do it by IHA. And on the right here we have filters where you can further filter and refine the data. So I'll give you an example of how this might work. I'll just go for a hospital here. It's a little bit laggy, so bear with me. We're on a Wi-Fi hotspot. So I'll choose a hospital, and you'll notice that the area here on the left, it's updated to show us the figures for Cork University Hospital. So that data relates to, these are the metrics for Cork University. So you'll get your total cases, average length of stay, etc. So the idea then is that you can make a direct comparison. So if you look at the visual on the right, the bar chart, it's showing us all of the hospitals within the Model 4 group. And we can change to a different model. So Cork is in Model 4, but let's suppose we're looking at a Model 3 hospital. You change to a Model 3, and that will give you the relevant metric for the Model 3. But let's just go back to the Model 4. If you're not sure which hospital, which model group the hospital is in, we have a little tooltip here which will give you a display of all of the various models. So once you've chosen that, then you can step through these metrics here. So we've got total cases. We can go to weekend discharge rate. So you can see Cork there is what, 4th, 5th from the top. So the idea is that you can compare the chosen hospital with the group that it's in for any of these these high-level metrics, dose to rate, and so on. Okay. You can also further drill down then. So for example, we could go to, let's say, cardiology. You can drill down to a particular speciality, and you'll see the total cases and the metrics for that particular specialty. And you can further drill down. You can drill down by DRG as well, or MDC, and the data will be filtered accordingly. With the filters here on the right, they're persistent, so they carry across every single page. So if you make a particular selection on this page or any page, it'll be carried across to all the pages on the dashboard. You can clear any of them individually, or you can clear them collectively with the clear all filters here. So that's how you can make a comparison, kind of a peer-to-peer comparison from its chosen hospital with the other hospitals within its group. The other way you can make a comparison is on health region. So if I switch to health region, now the visual will show us the 6 health regions, and you could choose a health region up here. And again, you can make that direct comparison, in this case Dublin North East, with the other health regions. And as before, you can step through the metrics here at the bottom, opportunity cases, for example, and you can kind of drill down on a specific specialty or DRG, MDC, etc., patient type, and so on. The other way you can make a comparison is by IHA, which is similar to what I just showed you with the hospital model and the health region. And then we have another tab here called Trends. And this will show you the trend of any chosen metric for any particular hospital. So if I was to go back to Cork again, for example, it'll show you the trend for, in this case, total cases, because that's what we've chosen. So we only have, as you can see, as I mentioned previously, we only have 2 months for 2025, January and February. but we hope to have more data soon. We only show complete months. And then we're showing 2 previous years. So we decided just to show 2. We could have shown more, but it gets a bit crowded. So just for comparison purposes, you can see the current year and then the trend for the 2 previous years. And again, you can kind of step through any of those metrics and you can see the trend for any of those metrics for any hospital. And again, you can filter it down accordingly. And you can see it by either month or quarter, depending on which is more useful. So that is a very quick run through of the national overview page. I'll briefly show you the consultant overview page, which is a very similar layout. The difference, there's a couple of important differences here. This is done from the perspective of a consultant where they can view their own records. The other difference here is that up in this section, again, what we call the data context, you'll see it's displaying data for, and you've got a drop down for a consultant and you've got the year. So now we have all of the records, and you'll see over here, we haven't selected anything yet, but you see there's 12.5 million records currently in the data set. So to give an example of how this would work, I could pick a consultant here. That's not an actual consultant number, that's a hashed, encrypted version. So don't worry, we're not showing actual consultants' numbers. Not today, no, not me. You can do it, you can if you want, but I'm not going to do that. So yeah, we've chosen a particular consultant, and you can see that they have 5,500 cases, so more or less, and we can see that covers from 2018 to 2025. We can, let's say, we select 2024 just to bring the numbers down, and now we're down to 558 cases, and you can see again we've got, so that's a 558 cases for that consultant, and you can see their average length of stay, consultant bed days over average length of stay, etc. And then in the visual, the bar chart here, you can see those 558 cases broken down by MDC. And you can choose DRG. Again, you've got the same 558 cases broken down by DRG. This tab here, the specialty tab. So we wanted, to give consultants a method of peer-to-peer comparison. And it's done on the basis of specialty. So, cardiologists would be compared to other cardiologists, neonatologists, other neonatologists, and so on. So that's how you do this under this particular tab, specialty. Now you see it says at the moment, it says selected specialty, none selected. So if we come to the specialty, you'll see we just have one option, which is general surgery. And the reason for that is that this particular consultant is obviously falls under general surgery. So that's why the data set has been filtered for that. So if I choose that, you can now see that it updates to give us our selected specialty. And there are 293 consultants in the data set for 2024 who fall under general surgery. And you can see they have between them 173,000 cases, an average caseload of 592. And then if you just read across, you can see this consultant has 558 cases, so slightly below the average. You can see their average length of stay is 8.5 days, whereas the average for that particular specialty is 4.9, and so on. So you get that, again, you get that kind of peer-to-peer comparison. And the trends is similar to what I showed you previously, except here you can, if you want, see trends for all of the years. So that's an overview. That's a brief run through of the consultant overview page. There are 5 other pages: length of stay, weekend discharges, day of surgery, surgical day cases, and DRG complexity. I won't go through all of them, but we'll just have a look at the length of stay page. So there's a similar layout to these. So what these pages do is they'll go into a slightly more detailed look at those particular metrics. So this will look more closely at length of stay, weekend discharges, look more closely at that, etc. So to give an example of how you might be able to use this, if I come to the DRGs, and I'll pick one, which is hip replacement. So you can see this visual here, you can show your selection by specialty, or it'll show you what specialty it's in, MDC, but we'll choose DRG and it'll show the actual one I've just selected. So that's hip replacement, non-trauma. And you can see that the average length of stay nationally will be 3.6 days for that particular DRG. Now if I go to hospital and if I choose Kappa,
yeah. Oh, you did do it. Okay. I'll come back to a question later.
Okay. So I'm just choosing Kappa and Croom, and it'll show you their average length of stay for that particular chosen DRG. And you can see that Croom is 5 days, obviously above the national average, and Kappa is 2.7, which is below. So again, you have that ability to do peer-to-peer comparisons either nationally or within other hospitals, depending on the DRG, and you can do it for MDCs or specialty as well. Sorry.
No, carry on.
Okay.
Yeah.
So that's the length of stay
Yeah.
page, and we also here, you see on the left here, there's another visual which shows bands of length of stay. So as I say, the other page is weekend discharges, day of surgery admission, and surgical day cases. Very similar layout, very similar idea. I'll just go to the DRG complexity page next, and I'll just clear my filters. So this page, there's 3 sections to it. On the data summary and statistics, we have some high-level measures for the complexity cases, A cases, B cases, and so on. You get the count, and you also get the percentage of those cases as a percentage of the overall record count. We also give a total here for the total cases excluding the uncoded, and a figure for the uncoded cases as well. And then we have these 2 tables here. They look similar, but the difference is that the one on the left, we can filter this any way we want, whereas this one will only go down to the hospital model. So again, to give you an example of how you might use this, I'm going to pick another DRG. I'm going to pick both of these. Okay, and then I will go for Cork again. So on the table on the left, you can see, again, we've selected Cork University Hospital. So these 2 DRGs, you can now see the case count. This is for all the, let's say, bring it down. Let's just look at 2024. So you can see the cases for 2024, the case count for both of those DRGs, and then the complexity breakdown. And then on the other side, we have the same, but for the model. So again, Cork is model 4, but you can choose whichever model you want. So now we have the case count for 2024 for model 4 hospitals. So again, you can do that compare and contrast, and you can see like the 8% is 9% as opposed to 13% from the model. So again, that's that's one of the main ideas of this ability to do this kind of compare and contrast. So those 5 pages allow you to do deep dive on different aspects, different high-level metrics. The last 2 pages, I'll just briefly look at these. These pages are more, one is geographic analysis and the other is demographic analysis. So these would be more, I suppose, informational rather than doing any deep dive. You're not necessarily going to get any major insights. It's more, obviously, with geographic analysis, we've got a bar chart and we've got a map. And the map is showing you the health regions. And for those who aren't familiar with the new health regions, it just gives you a nice breakdown, a kind of a visual way of showing the spread of the cases based on the metric that you've chosen. So obviously the darker colour will give you the higher metric. So in the case of total cases, it's Dublin and Midlands is the highest, whereas Midwest is the lowest. If I was to change that, you'd see the map will shift. So now it's the Southwest, which has the highest for weekend discharge rate. And the bar chart is telling you exactly the same thing, but arguably it's more informative looking at it on a map. And again, you can also drill down here on these filters at the side to further refine that. There's another map that we have, which is for hospitals. This will show you the location of each hospital. Slightly different map, a bubble map. By default, it'll show everything, but if we pick a region, it'll just show you the locations of those hospitals. And again, if you mouse over them, you'll get the metric. You can do it by hospital as well if you want, or IHA. Another way you can do it is by looking at a specialty. So for example, if you're interested in, let's say, cardiothoracic surgery, it'll show you the sites where that specialty is carried out. And again, you can step through these metrics here. You can look at the weekend discharge rate or the average length of stay for that particular specialty. And you can further drill down again using any of those filters on the right. The demographic analysis page, this just looks at 2 main demographics, which is sex and age. And again, it just breaks down, I'll just clear those filters. It just breaks down we have age bands. You can do it by all patients or by sex. There may or may not be any interest in doing that, but you have that option. And then the DRGs, specialties, MDCs and DRGs, they're also broken down by male or female. So that's a pretty
Okay,
brief
impressive.
run through.
So John and Mary, many, many thanks.
Thank you.
And